Hello, welcome to Pediatrics. I'll be talking on general pediatrics initially, and then slowly I'll start discussing on several different diseases in pediatrics. Normal child and nomenclature. Today I'll be discussing on this topic. I am Dr. Kalpana Malla, professor from Department of Pediatrics. Okay, now you see a child is not a miniature adult. They are totally different as disease, clinical manifestation, investigation and treatment in these children are totally different when you compare from the adults. Though the disease is same, the name of the disease will be same, but it varies in different aspects. So today we'll just see how they differ from adults. If you see, look at the rate, disease rate, it is 2 times more common than in adults. And the common disease occurring in children are different from the common disease occurring in the adults. So common disease you see in children are acute respiratory infections, diarrheal diseases, protein energy malnutrition, congenital malformations which are diagnosed in the early childhood, genetic and inborn error of metabolism, they also manifest during the childhood age. And there are many vaccine preventable diseases for infectious diseases. So for children there is a big sector immunization or vaccination. So if you prevent this, those are preventable by vaccines. So vaccine program also falls in children age group. And the disease pattern is different from the adults. And the disease is different in different age group. If you see in the childhood neonatal period, they have a different diseases, like in the neonatal jaundice, which does not occur in the bigger children. Jaundice in bigger children, jaundice in the neonate, it is totally different. And then the cause of jaundice or mechanism of jaundice is totally different. And common disease in the 1-year-old child is acute respiratory infections, diarrheal disease and all. And then slowly as the child grows, the disease pattern will be different. And when you compare the mortality morbidity, it is much higher in case of children than the adults. And the clinical manifestation of disease is different in different age group in a child. Suppose a child has meningitis, a newborn has a meningitis. Clinical presentation will be totally different. And even the treatment will differ in the neonatal age group or a child of 1 or 2-year-old age. So this way, same disease have different clinical manifestation and different treatment in case of children age group, which is not there in adult. Adult has a uniform similar type of presentation, and then they have a similar type of same treatment. But here it is different in different age group. The drug doses are calculated on the basis of body weight or meter square body surface area. In the adults, you just give 1 tablet of some medicines, but in case of children, it is different. For each child, you have to see the weight and then calculate a dose for the child. So the dose will be different for different individual child. So with these points, with these factors, it is seen the child is not a miniature adult, though they are having a similar structure. Now come to pediatrics. What is pediatrics? It can be spelled as Pediatrics or Paediatrics. So pediatrics means this is a branch of medicine which deals with children and their diseases. Birth to 18 years has been defined as child, or this is a child age group, children age group. So what is normal for a child? That depends upon the child's level of development, but it varies greatly among children of same age, this development, because it is affected by child's own family, culture, social background in which the child is growing. So these things affect the development. So child's development means that maturity, how the child is growing. Now come to child behavior. There are 3 types of behavior that is noticed in a child. Number 1 behavior is wanted and approved behavior. This means a child is very good, they do their homework, they are very polite, well behaved, and they give less trouble to the parents or society. Number 2 behavior that is tolerated under certain conditions. Child is good and then obeying, but under certain conditions they become different, and then it is difficult to tolerate those parts. So during the time of illness or stress, a child becomes different because they are troubling the mother more, seeking attentions. Birth of a new sibling, they don't know what is happening, and then they start showing different behaviors. And then sometimes they show regressive behavior. They try to talk like a baby when they are already little bit big. So that is also just to seek attention, and then or being excessively self-centered. So this behavior, number 2 behavior, is actually to seek attention. A child is showing these behaviors. So these are tolerated but under certain conditions. And number 3 behavior, this cannot and should not be tolerated, because this child becomes harmful to others. They start showing harmful actions. They are very aggressive, destructive. They show destructive behaviors. They start stealing, smoking. They fall into substance abuse, school failure, or an intense sibling rivalry. So this type of behavior will be a worry to the parents and will be troublesome to the even to the society. So these are the 3 types of behaviors a child shows, and these behaviors are always affected by the child's own family, culture, or society where the child is living. Now, overview of child development. So this means change in the child that occurs over time. The changes follow an orderly pattern that moves towards greater complexity. So orderly pattern means every child follows the same order. When a child develops, first the child learns how to roll over, then sit, then stand. A child doesn't stand first and then later go and roll over. It is not like that. So every child, it can be little bit early or late. Some children may roll over by 6 months, some may roll over by 7 or 8 months. But they roll over first, then only sit and then stand. Some children, they stand at 9 months, some may be at 11 months. Okay, so the rate may differ, but that pattern sequence is same, and that moves towards greater complexity. So their movement becomes more and more complex as they grow bigger and bigger. So this is a child development. So starting from the very beginning period of development. So initially there is a prenatal period. In this, when you say ovum, this is 0 to 14 days. Then comes embryo stage, that is 14 days to 9 weeks. Then comes fetus, that is 9 weeks till birth. So before birth, a baby is called fetus. Then after that, perinatal period comes. So this is defined by WHO, that is 22 weeks of gestation to 7 days after birth is known as perinatal period. After that comes postnatal period. So this is a neonate. Birth till 28 days of life is known as neonate in the postnatal period. Then comes infancy period, that is till 1 year. After 28 days till 1 year, infancy. Then comes toddler, 1 to 3 year is known as toddler. Then comes preschool child, 3 to 5 years. School age child, 6 to 10 years. After that is also school age, but they become adolescent. Adolescent is divided into 3 parts: pre-adolescent, pubescent, and post-pubescent. Pre-adolescent for girls starts from 10 to 12 years. For boys, 12 to 14 years, little bit later. Pubescent, puberty of girls starts earlier, so 10 to 14 years is girls. For boys, 14 to 16 years. For post-pubescent for girls is 14 to 18 years, and for the boys it is 16 to 20 years. Now coming to nomenclature of a newborn. So newborn is such a small or the very youngest part of a human life, and it has a big nomenclature. So newborn means birth till 28 days, that is a newborn, neonate. Newborn is when they are just born very early. So this definition of the neonatal period is birth to 28 days of life. Perinatal period 22 weeks of gestation to 7 days of life. Now come to the definition. Very early neonate or the newborn. This is known as from birth till less than 24 hours of life. So these are very early. Neonate is a newborn. Then comes early neonate from birth till less than 7 days of life. Then comes late neonate. Late neonate is 7 days of life to less than 28 days of life. Then classification of newborn based on the gestation age. According to this, there is term, preterm and postterm. Term means baby born after 37 completed weeks up to 42 completed weeks. That will be 37 to 41 6/7 weeks of gestation irrespective of the birth weight. Then comes preterm, that is also known as premature, immature or early born, premature, born early. So these are the different terminologies used. So this is a baby born before 37 completed weeks of gestation or less than 259 days irrespective of birth weight. Postterm, also known as post-mature baby, baby born after 42 completed weeks of gestation or more than 259 days irrespective of birth weight. Now, depending upon the birth weight, a newborn can be, this will be irrespective of gestation age. A baby can be normal birth weight, that is 2500 grams to 3999 grams is a normal birth weight. Then comes low birth weight, that is less than 2500 grams. Then comes very low birth weight, this is less than 1500 grams. Then extremely low birth weight, that will be less than 1000 grams. Then pre-AME less than 750 gram, and micro pre-AME, that will be less than 500 grams. So very low birth weight ranging from 1000 to 1500 grams will look like this. Extremely low birth weight weighing 500 to 1000 gram looks like this. So in detail about the clinical features I'll discuss in different classes. Now, depending upon the gestation age and birth weight, when you combine gestation age and birth weight, there are different classifications. So for this you follow intrauterine growth chart given by Lubchenko et al. So that chart is followed, and then you can, depending upon that, you can classify a newborn as small for date or small for gestation age. This is birth weight less than 10th percentile for that gestation age is called small for date or small for gestation age. Birth weight when it is less 10th to 90th percentile for that gestation age, then this is known as appropriate for gestation age or appropriate for date. And when the birth weight is more than 90th percentile for that gestation age, then these babies are known as large for date or large for gestation age. So based on the gestation age and birth weight, a preterm, term, postterm can be all three types. A preterm can be small for gestation age, appropriate for gestation age, or large for gestation age. Similarly, term and postterm can also be small for gestation age, appropriate for gestation age, and large for gestation age. So this is a chart, the intrauterine growth chart, where you just follow. So horizontally you are seeing the gestation age, and vertical it shows the weight. So by this you can find out whether it is appropriate small for or large for gestation age. So when they are following within these lines, curves, then they are appropriate for gestation age. If they go into the blue line above the curve, then they are the large for gestation age. If they are falling below this curve in the gray line, then they are the small for gestation age. So this is a picture showing a small for gestation age. They look like this, thin and long, like a marasmic child. large for gestation age, more than 90th percentile, looks very plump. Usually infant of diabetic mother looks like this. And this is a appropriate for gestation age, looking normal. So normally we see this type of babies. So preterm, prom, and then term, this is small for gestation age and appropriate for gestation age babies. Thank you. We'll meet you again in another class.